Morning everybody. I'm pleased to say the number of cases in New South Wales continues to stabilise and that's a positive thing. However, as we've been saying, the number of community transmissions continue to increase and that is what we need to keep a very close and watchful eye on. We have to adhere to the restrictions that are in place and I want to thank everybody for ensuring that's the case. I said yesterday that social distancing would be a part of our lives until there was a vaccine or a cure, and that's absolutely the case. But I also want to stress that social distancing is different from restrictions, and we get data on a daily basis from our health experts, and every month our health experts will give us advice as to whether there is an opportunity for us to relax any of the restrictions. And I want to assure the community that if we did go down that path, it would be based on health advice, and we are going to assess that on a month-by-month basis. So whilst we get data every day, we need a sufficient amount of data to inform us as to whether the new restrictions we have in place have been successful and to what extent they've been successful. And then obviously the health experts give us the advice as to whether that means we can relax any of the restrictions. So whilst we're out and about, until there's a cure, we'll definitely need to all keep the 1.5 metre distance from one another. However, the restrictions are a different issue and they will be based on health advice as to whether or not we lift any of the restrictions. But I also want to stress the risks. When you do lift any of the restrictions, it does mean that there'll be more people admitted to our hospitals and more people who will succumb to the virus. That's a fact. So we have to be aware of that. And these are all the decisions we weigh up based on the health advice. And these are all the decisions that we'll keep the public informed about. But the risk is that when you do relax any of the restrictions, that it does mean more people in intensive care units, more people getting the virus, and unfortunately, more people dying. That is the fact of this virus. And if you look around the world, you can see how some cities and some countries are going through a horrible time, recording thousands and thousands of deaths. We are, in the meantime, whilst we have these restrictions in place, we're preparing our hospital system, and I'm pleased to report that New South Wales has already doubled its intensive care capacity. We now have more than 1,000 beds with the staff members required, with the ventilators, with the other equipment required. That is we've doubled our capacity, and our aim is to triple and quadruple our capacity so that our hospital system is well prepared for what awaits us down the track. And that is something we're working very hard on behind the scenes. And it's positive news, a positive development that we've been able to double our capacity already. I also wanted to provide a new bit of information to the community. As you recall, during the bushfires, we had an app called Fires Near Me, and that was proved to be a really good source of information for the community. Now, through Service New South Wales, if you download the Service New South Wales app, you will get daily updates on COVID. You'll also get text messages about positive advice that you might like to adhere to. At this point in time, we've already got 1.6 million people who've downloaded the Service New South Wales app. Those citizens will automatically get our messages, automatically get that information. But if you also want to get that information, please download the Service New South Wales app. It's free and it will provide you good information. We're updating it and improving it to make sure it's timely, and also the possibility about sending you direct messages. You can opt out at any time, but it's a generic message that we can send everybody who's got the app if there are any new developments or any new updates that we want to convey to the community. Again, can I reinforce the message? We're grateful that the vast majority of our community has really stepped up and taken those restrictions on board. We know Easter is coming up. We know that normally it's a time for people to move around. Please don't this year. Please stay home. Please respect the restrictions. The better we do, the more options we have in the future about being able to ease some of them, if at all. So please know that the harder we work now, the more options we have as a community moving forward, and the better options the health experts can give us in terms of advice moving forward. But it's pleasing to see the number of cases, the new cases have stabilised or are reducing, but obviously it's an ongoing battle to make sure that we keep those numbers down, and more critically, that we stop the spread. And again, in those areas where the community transmission is highest, our health experts have ensured that there's a relaxation of the testing rules, that we're asking people to proactively come forward and get tested, because there's no doubt, and this is why I'm pleased with the way New South Wales has gone in this way, is the more you test, the more you find. And New South Wales has done an incredible amount of testing. I believe the figure's around 120,000 tests so far. which is huge, especially compared to other jurisdictions. And we want to maintain that because the more you test, the more you can isolate or find that community-to-community transmission, which is the biggest risk to our citizens. Now I'll ask Police Commissioner to give an update in his areas of responsibility, then Dr. Kerry Chant will also provide you an update on the number of cases. Thank you.
Good morning, thanks Premier. And this morning we will see some 250 Australians leave the Swiss Hotel, and I want to thank all those involved in the operation, including those Australians, and I wish you well returning home today. There's about 30 Australians who will remain in the hotel. They are not under any isolation orders, they're just waiting to make their travel home. But I think it's a small sort of step forward in terms of the isolation and seeing 280 people over the next couple of days go home. Then of course Sunday we start to see, thousands of people come out of the Sydney hotels and head home, and I think it's a wonderful thing for all those Australians, and we thank them for their patience and really protecting the safety of the people of New South Wales. Over the next couple of days, New South Wales Police will be out on our roads making sure that people adhere to the orders around the Easter holidays. We've heard the warning from our Premier and the Prime Minister. We will be going through caravan parks early, issuing warnings to people that may think that they can get around these laws. It's important over this weekend that we continue the good work and we continue to isolate, as frustrating as that may be. There were a number of tickets issued over the last 24 hours. Most of those were for people who had been given multiple warnings to comply, and they just simply don't care. So I think we will continue to do our best to give people as many warnings as we can, but the reality is some people just don't get the seriousness of it, and tickets will continue to be issued. But the big focus will be on our country roads, those back streets, our main highways, the caravan parks right across country New South Wales. Police will be patrolling those. People will be given one opportunity to pack up, go back to your home state, and go back home. Otherwise, we will unfortunately have to issue tickets. Thank you.
Thank you very much. So there's been currently at the total stands at 2,734 confirmed cases. Pleasingly, we've seen 48 new cases overnight, and this compares to 49 new cases, and the trend has certainly, as the Premier has indicated, a stabilisation of new cases. In addition, what's pleasing is yesterday and earlier in this week we called for an increase in testing. We had seen some decline in testing rates, and it's pleasing to see that the numbers yesterday were an increase. We tested 2,900 people. We again are urging people to go forward, particularly in those suburbs I'd indicated yesterday for targeted testing. There are 21 deaths in New South Wales, and again no increase in deaths in the last 24 hours, and there are currently 227 people being treated by New South Wales Health, including 36 patients in an ICU, and 22 of those are ventilated. Thank you.
Premier, you mentioned about easing restrictions. There are reports today in the press about potentially a May 1 date. How likely is that?
Yeah, look, that'll depend on health advice. We know that the restrictions are having an effect, but it takes us a couple of weeks to get that data through our health experts to be able to advise us. So I don't want to... there could be a chance, if the health experts deem it appropriate, for us to look at some relaxations. It's a rolling monthly basis that will look at that. At this stage, obviously, as I said, the restrictions are having a positive impact on the number, not just on the new cases, but also on us being able to contact existing cases and make sure people are isolated. But if the advice in a couple of weeks' time is that there might be a couple of aspects that we can tweak to provide relief to our citizens, well then we'll take that advice, but that comes with risk, and I need to be very upfront about that. Every time you relax a restriction, more people will get sick, more people will die, and it's a horrible situation to be in, but they're the choices, they're the options, and we need to be very upfront about that. But can I please ask everybody to stick to the rules? Everybody's been doing so well. I know it's hard. All of us are in this. We all know how hard it is and what impact it's having on all of us and our loved ones. but it is having a positive effect. We have managed to contain the spread, and we have managed to ensure that those people who do have the disease are isolated and stay isolated. But if at any stage in the next few weeks, if the health experts give us advice to say that there's an opportunity to relax any part of the existing restrictions, we will take that advice.